I am Stephanie Abbu. I am so excited on behalf of the Academy of Neonatal Nursing to be able to spend time with Kris Karlsen. Dr. Karlsen is our latest inductee to the Ann Hall of Fame. And as a member of the awards committee, I get the opportunity to spend time with Dr. Karlsen today. And so I would love to say congratulations and welcome to our time together. So excited to be able to help you to reflect on this award.
Well, thank you so much to Ann, to all of the award committee. It came as a big surprise to get the email that I was an inductee into the Ann Hall of Fame. And I'm just really honored to be here today, so thank you.
I am very honored to be able to get to spend time. You have such a tremendous career to share. Cannot wait to learn more of the details about that and would love to start the conversation learning about what initially sparked your interest in neonatal care. How did you find the NICU and what inspired you to create the STABLE program?
Well, I actually found the NICU quite by accident. I graduated in 1978 with my associate degree in nursing. I did what every young new nursing student should do, which is take a trip to Colorado and from New Hampshire. And when I got there, I started my first job in a NICU there. But my initial introduction at the hospital was to work on an orthopedics floor on night shift. And it was me and one elderly, and I don't call them elderly anymore because she's probably only like 55 years old. But it was me and another nurse basically taking care of all those patients on that floor at night. And on the same floor was a door that I would pass as I went down the hallway to take care of my patients. And it was a door with a stained glass window, and it said intensive care nursery. And one night I was just too curious and I opened that door and I was hooked instantly. Back in the day, all the lights were on. Everybody was, basically lots of beeping going on everywhere. And there were a couple of nurses in there taking care of all those patients. And I started to ask them, what they did. And I took a look at these babies and I thought to myself, I just have to do this. This is for me. And I transferred off that orthopedics floor into the NICU and I never looked back. So with that, though, was an interesting evolution in my career. And that was that on the day shift, we had primarily pediatricians running that nursery. It was probably then a level 2.5, which would be a low level 3 now. And there was a nurse practitioner in there, Laura Lee Cross. Her name was Laura Lee Ball at the time. But as they would come around on rounds, I thought to myself, I want to know what she knows. I was always really curious to learn more. And now I had an associate degree, but back in the day, you didn't need to have anything above that to go and pursue higher education. I went to a nurse clinician program in Marquette University and got my neonatal nurse clinician, which basically we called ourselves nurse practitioners at the time. And with that advanced education, a couple of years into my nursing career, I found myself on transport, which was also very new back in the day. And I also was willing to take on an outreach educator role. So I wore 3 hats, took care of babies in the NICU as a practitioner, went on transport, and was a nurse educator for our outreach in that area. With that came the finding that when we would go pick up a baby on transport, there was always a ton of uncertainty about what they should be doing for these babies. And just to give you like a little bit of a historical perspective, if you think about what was going on in 1982, in 1976, regionalized perinatal care was born. And that was a march of dimes collaborative of 20 plus organizations that got together that said, how can we take care of moms and babies better? And what they established was that if you are a regional center, you'll become responsible for the education of your community hospitals and the transport of patients from those hospitals to your center. So I now was maybe 6 years into regionalized perinatal care, finding myself on transport. And as I went out, taking on the job of what we're supposed to do, educate them, I found out that people just didn't know what they wanted us to do, wanted for them to do while they were waiting for our team to arrive. So I put together Stable as a very accidental educational endeavor. And I remember thinking, what do we want the baby? We want the baby stable. Well, it fits under S. Well, sugar and the issues of hypoglycemia and establishing IV access. We need those babies made NPO, that sort of thing. T was easy, temperature, thermoregulation, so critically important for survival. A, airway, again. What fits under that? Well, supporting breathing, knowing how to assess when the baby's getting worse and what to do. B became blood pressure, issues of shock. L was lab work, and I wanted to intertwine neonatal sepsis in there. So what labs can we obtain? And that's how infection became addressed. And then E was the most important of all, really, the emotional support for that family. How do we support them as we are whisking their baby away? It's probably the worst day of their life. So I did believe very strongly in the power of education and started in a bachelor's program in Grand Junction, Colorado at Mesa State College. And as part of my bachelor's training, one of the things we had to do was come up with an educational project. And I just wanted to share with you, I'm going to share my screen just for a moment, just to show you a few things that occurred in the process. So I think I mentioned that. Here's my screen. I'm going to pull this picture over so it gets a little bigger for you. Can you see that screen all right?
Looks great.
Okay, so in 1982, as my little local outreach, this was page 1 of 4 of sugar, and then temperature, and then airway and blood pressure module, and lab work, and emotional support. I mean, that was the very first iteration of Stable. And what I did was I took that and I decided, you can find this screen easily, to present that. And I had accolades from my instructor about this curriculum. Then I moved to Utah, wasn't doing transport any longer, working at Primary Children's Hospital in the mid 80s. But again, pursuing higher education. I didn't like that I only had a certificate as a neonatal nurse clinician. And every time I went back to school, I learned so much more. So I enrolled in the University of Utah and master's program. And I used as my capstone project that which was very popular in Colorado. And this was my March 1991 teaching plan, Stabilization of the Neonate the Stable Way. And there was the agenda for my all-day course. But one thing that really stood out to me was my instructor said, I think you're Kris Karlsen, who has prepared the attached materials. Christine Antonelli, that was my maiden name. You probably should publish your work. It looks good. Now, some of the best things that have happened to me have come from my mentors and from people who know a lot more than I do. And that was yet again another faculty that believed in me. So what I did was this is the capstone, very first book that was printed at Kinko's Copy. And my very first medical illustrator I hired to do the cover. But I went and I presented my work at an outreach educators conference. This is me back in 1994. And the poster was about transporting newborns the stable way. And a lot of people came to this perinatal outreach educator poster, a lot of educators, and said, well, I teach sugar and I teach temperature and I teach about airway and I teach about lab work, but I've never done this all as a program. And they used the term program for the first time, which was a trigger for me. I never thought of this as a program. And I collected their business cards and addresses because everything was still snail mail back in those days. And I said, if I ever do anything with this, I'll contact you. So along comes 1996, and I'm finished with school. And I am pregnant with my second child with threatened preterm labor on bed rest at about 24 weeks, and I'm bored to death. So I thought to myself, what can I do? So I pulled out my computer and I started ordering books that were mailed to me, and because I'm not supposed to get out of bed. And I finished the instructor component of Stable. And I wrote these letters to these outreach educators around the country and said, I think I have something for you. And they said, okay, what do you got? And I sent an order for them, and they ordered the slides I'd put together, the instructor book I'd put together, and the learner manual. And from there, it really started. And I learned something very important early in my career. And that is that these people were teaching this all over the place, regionally in their areas, but for me, throughout the United States and Canada, I involved them as well. And they wrote me back and they'd say, I like this about your program. I don't love that. You know, we do it differently. Can you consider changes? And I learned very early on, there's no place for ego in this process. You have to just be able to take that advice and realize there's truth in everything. And I revised Stable. And so in 1996, now 2 years after this conference, the company was established, and I was taking orders and hiring people to help me, you know, as needed for shipping and that sort of thing. So then what we have to realize is that, backing up just a tiny bit, in 1987, the first NRP was written. You know, prior to that, we didn't have any guidance. So now we are in 1996 and Stable is born. So not that long after NRP was born. The other things that really transformed what I was able to do was that by the mid 1990s to the late 1990s, internet had become available. Email was much more commonplace. Like, people don't remember the .com era like I do. Hotmail, you know, You've Got Mail, the movie. And other things that really happened that were landmark to me was in 1999, I met my PowerPoint designer and dear friend and colleague, Mary Pachalski. And Mary transformed Stable for all of us. We went from static slides to PowerPoint. And the ability to have an electronic version of what we taught, really, and using color and animations, really helped us educationally. Those of our newer nurses out there that have only ever known that can appreciate what they're looking at with Stable now is Mary's work to this day. So in 2021, I do have to recognize another thing. Around 1999, when I married, I also hired our office manager, Beth St. Thomas. She still works with me today, and she takes care of all of our instructors. She still answers the phones. And Mason Meinhold, our National Instructor Course Coordinator and roster manager, he came along to us in around 2007. So historically, Stable has grown not only because I had a good idea and the education was needed worldwide. I mean, we're now all over the world in 55 plus countries, but it's not just my good idea and ability to creatively show you what Stable looks like in a book format, in videos and in slides, but it's the people behind you. It's always the team. And I still have a very strong team, and I have my family to thank. One last thing I want to say about this is that as Stable grew, I used a lot of common sense and a lot of airline travel and went all over the world training people and doing the thousands and thousands of train the trainer courses to teach people how to do, how stable is presented. And I went on every business trip in the airport and bought a Beanie Baby for my daughters at home, my little girls with my husband. And I bought a Beanie Baby. And one day my daughter asked me a few years ago, where are those Beanie Babies? And I laid them all out on the floor and laid them out by date. And I had a lot of like tension in my heart about how often I was leaving. But I left home a very supportive husband and a grandma nanny that took care of our girls. So I'm saying it's not just me, but it's my mentors. It's all the neonatologists that have come into my life, all the practitioners, therapists, everyone that has very willingly helped me, to weigh the evidence to support me. So I'm here to say, if anyone is listening to this, thank you for your contribution. You know who you are.
Love that so much. And I love the being able to walk through the timeline and really that example for your daughters, the legacy, the impact of what you were trying to do and what did do with this program. You did mention about getting that feedback from others and then making, adaptations, improvements to the program. How do you ensure that the curricula remains current with evolving evidence and clinical practice today?
That has probably been the biggest challenge I've had with Stable is ensuring the integrity of the science. And what I started doing early on, probably by about the fourth edition of Stable, was I decided to invite content reviewers. I call them content reviewers because if you are a specialist in a certain topic area, in the sugar module, for example, or in the temperature module or in airway, if you were the persons that were writing the textbook chapters and the people I was hearing at conferences, then I would reach out to those people and I would ask them if they would be a content reviewer for the curriculum. And I always do like the first pass writing and research, and the internet certainly broadened that ability from going through the library, catalog cards, to now just being able to search in the online libraries. I mean, it's amazing how much that improved things. But I would write first pass. I would do the first pass writing and editing and researching, and also staying very clinically involved myself at a level 4 tertiary children's hospital NICU. That really helped me a lot too, to know what was evolving and going to a lot of conferences. But I did a content review invitation, and those people, whether they were physicians, pharmacists, surgeons, nurse practitioners, nurses, transport nurses, respiratory therapists, they all evaluated the science, and we then sent it out to everyone and they had a chance to weigh in. And so that's the model that has worked for me, and it's the model that I'm going to continue with. Now, in between editions, what I do is I just follow the literature very closely, and I reach out to those content experts, especially the specialty advisors, for their advice. And there are a few things, for example, now that I need to communicate to our instructors out there, Stable instructors, with a new clinical report that came out from AAP on hypoxic ischemic encephalopathy, and that there probably is a role to consider cooling beyond 6 hours because of a study that showed there can be some support for that or some benefit to that. Or should we cool babies that are 35 weeks gestation or not? Well, there's a study published, a very much a randomized controlled trial that did establish that if you're under 36 weeks gestation, there's a higher risk of mortality for those preterm infants. But AAP left the window open that if the baby's 35-week gestation, then you discuss that one-on-one with the family and make a decision if you should cool or not. And then, of course, mild cooling is now being evaluated. So I followed the science as an example very closely of what's happening in those areas. And I'll continue to do the same.
Fantastic. When you think about and really reflect on your career, is there a particular moment or case or achievement that really stands out as being especially transformative or impactful? For example, your dissertation on neonatal transport won the American Academy of Pediatrics section on transport medicine Best Training Paper Award. And so would love to hear about what you would like to highlight, but would also hope that you'll elaborate more on your findings and their implications for transport teams.
Yeah, boy, when you think about a career that's been more than 40 years like mine, there have been so many things that have happened along the way that have inspired me to have people believe in you, to have them say things like, you should publish this. I remember that one of my very early memories of a family interaction was when I was a pretty new NICU nurse and a family that had to say goodbye to their 32-weeker. And I had taken care of this little baby, through her 2-week journey in the NICU. And that family wrote a letter to Sister Mary Eloise, who was working at the Sisters of Charity Hospital in Grand Junction, Colorado. And one of the things that they wrote in there about their experience in our NICU was that Kris Antonelli was the silver lining in our very dark cloud because she did these things with our baby. And those things I did with their baby and for their baby, I did them as part of my nursing care. But for them, that was incredibly memorable. That it gave them hope. It gave them. I get kind of choked up when I think about it. But for me, I learned very early on the power of what we do at the bedside, that we don't know always that it's seen, but we have to always remember that it is. And so that I carried forward with me as I took care of families and tried to listen to them, tried to support them, and tried to give these babies the care that they needed despite how hard our job is. And then another moment stands out in time, which I think everyone is going to remember, and that was 9/11. And here I am teaching an instructor course in Lincoln, Nebraska with Tracy Karp, who many, many, many of you know. And that morning of our first day of class was when 9/11 happened. And we all had our hearts racing. We all needed to know where our families were. And we took a break in the morning. And I said, everybody, go contact your families. We turned on TVs. We started watching the news. But I said, come back in an hour because we need to decide what we're going to do. Are we going to do this or are we going to go home? And everyone came back except for the 2 nurses whose husbands were in the military, and Omaha, Nebraska is where our, launchers are. They had to leave the class, very sadly so. But everyone in the room said they wanted to stay. They had touched base with their family. They thought the education was important. And Tracy and I, we carried on, and we taught that class. And I said to that room of people, there's really only one other place I'd rather be in, and that's home. But if I can't be there, I want to be in a room full of NICU nurses. Like, that's your family. And I think everyone can embrace that. And I hope that they have that kind of that feeling as well with their families.
That's so powerful.
And
Certainly the
then,
NICU
yeah,
becomes your family.
yes. And then, of course, after that, that's 2001. But after that, every step of the way, there are momentous things that occurred that I'm forever going to carry forward with me. It's hard to come up with any one thing, but the families you meet, the staff you meet, the conferences you go to, the people you connect with. So hard to put a finger on all of that, but that's what I think.
such an excellent point about attending conferences, networking, making those connections, and how really being able to lean and learn from each other, lean on each other and learn from each other. It's so powerful and really can help to transform a career. If you would highlight for us your dissertation findings, I find them to be so interesting and definitely want to make sure we touch on those.
Yes, that was a really interesting part of my doctoral preparation. I actually went into the doctoral program at the University of Utah, the PhD program, because I had been contacted just prior to that by the Ministry of Health in the Bahamas saying, will you come to the Bahamas and help us with our infant mortality issue? And I don't know how people would feel, but imagine your phone ringing out of the blue and it's a Ministry of Health asking you that question. And I thought to myself, I don't even know about the United States infant mortality issue and how to tackle it. So I thought to myself, I did go there, but I on full disclosure, let them know I'm not sure this is going to be that helpful. Let's talk about it. But I ended up deciding I needed a PhD. I needed to know how to get my questions answered. So I started the doctoral program at the University of Utah with the intent to learn enough about nursing research to evaluate Stable's impact on outcomes. And I devoted my first 2 years of that program to taking every bit of coursework I could, including a practicum on infant mortality in the US. So I learned how to find answers to those questions, only to be told by the faculty there that I would not be permitted to do my dissertation on Stable. You're the author of the program. No matter how unbiased you try to make it appear and how people will never believe your research, you can't do that project. Well, I was devastated. But what I also thought was, well, what else can I do? Because part of it is that I was going to involve transport teams to evaluate. They were going to be my audience to evaluate Stable and its impact. And so I decided to survey them. I don't ever do anything small, I have learned about myself. So I decided to survey all the transport teams I could find. Well, I learned that at that time in the early 2000s, there were about 6,000 hospitals in existence. Many of them were community level hospitals. I used a multiple search strategy to find out where the NICUs were. And I found out that there were just shy of about 1,000 newborn intensive care units in the US. I reached out to all of them and found out that about 40% of them, and I mean phone calls and ad nauseum, I found out about 40% of them had a NICU, a transport team. So I enrolled them in my study, and about 350 of them completed the survey, about an 88% completion rate. And what I found from that was that about 68, just shy of 70% of them were unit-based teams, and the remaining 32% were dedicated teams. And there was other things that I found out, like unit-based teams tended to transport less than 200 babies per year, whereas dedicated teams could transport a higher volume than that, 200 plus. I surveyed how did you travel from your hospital to the other hospital. Almost all of them used ground. There's like one transport team that didn't use ground because they were only able to go by air from their location. And then the transport teams were much less likely to use helicopters and planes, whereas dedicated teams, many of them did. I found out there were 26 different team compositions with RN-RT as the primary one and RN-RN following after that. And then I also evaluated various aspects of what else they did, like how are you trained? What are the educational requirements? How do you determine readiness for independent transport? And then I did what everybody is supposed to do, what they encourage you to do when you get your training is to go disseminate my research. And so that next year, after I graduated from that program, I presented at 4 large neonatal conferences. And I presented my findings, of which one of them was the one that the AAP transport section awarded me that best training award. So that was really very gratifying to get that recognition as well. So I saw that research was cited. It was published in Pediatrics and in 2011. And that research was cited very commonly until a more recent study was done of a much smaller number of teams that found very similar team composition things. But I'm very happy to share the entire dissertation with anyone that is interested in the minute details, because I found out so much using this web-based survey.
Fantastic. It's just when you think about some of the challenges in the past and how we've overcome those, and what people support, technology support, and really how that helped to shape from beginning to now. I would be very interested, as we close out our time together, for you to share with us what are some of the current challenges in neonatal care that you believe require urgent attention from healthcare providers and policymakers. When you think about the world today, what could you share with us on that?
As you ask that question, it's kind of a loaded question in a way. When I think of neonatal care and what we do at the bedside, I think I and everyone else were focused on, what it means for every parent and every baby to be cared for safely and with dignity, and using our best evidence that we have at the bedside. So how do we get there? How are we influenced by what we need? And so I think of policymakers and the power that they have to influence research funding. And so my attention goes to like how imperative it is to support the generation of new science so that we at the bedside can practice safe, evidence-based care. And so we all know that we have an ongoing and persistent problem with higher infant and maternal mortality rates based on race and ethnicity. So the recent cutting of NIH funding and recent cutting of the National Institute of Nursing Research funding that addressed diversity, equity, and inclusivity is not going to help us to solve this problem and to create new programs that address it. So what do? I have to encourage people to remember the power of many voices contacting your congressional representatives, and we can all consider getting involved with like political action committees through NAN and the American Academy of Nursing. That's going to take longer to be involved that way. And I also have to say, on a positive note, the lobbying has helped. The outreach has helped, because the recent refunding of the bipartisan Title VIII nursing workforce development program was the right thing to do for our congressional representatives, as that money is going to support nursing education and faculty development. And especially in light of the many, many nurses who are planning to retire. The average age of the nurse is 50 now. Many nurses are planning to retire in the near future, and they're leaving the workforce also because of being staff overloaded, and because of stress. So that funding of that Title VIII nursing workforce was extremely helpful. But I also feel for the nurses and the nurse practitioners who are navigating the misinformation that their families may be hearing about vaccines and vitamin K shots. And so now is the time. I'm going to implore everyone to go ahead and follow the advice of the American Academy of Pediatrics, who are highly supported by many other physician organizations and nursing organizations as regards immunization practice, and to just continue educating the families about safe vaccine administration, as well as the importance of those vitamin K administrations at birth. So it's difficult. it's challenging, I really feel, for what it's like at the bedside right now for everyone. So shifts in policy and funding on a national level, they take time. And across my career, I've seen administrations and lawmakers who have been supportive and those that have not been as supportive, such as in our current time. So we are feeling like maybe we're going backwards, but things shift, things change. And so we have to remain hopeful. And what we can do on our micro level is to reach out and contact our representatives. But I've always felt a personal sense of purpose, that I can show up for my families in a positive way to educate them and listen to them and help them navigate a journey for which many of them have never been on. And so I encourage anyone hearing this to remain hopeful and remember why you chose nursing and why you chose NICU nursing, and to know that what you do is so meaningful and so important. And I implore people to find a way forward to stay positive and to also support those around you. It's reaching out to friends, helping those who struggle, supporting those who make an error or a mistake or have a near miss. People live with that. I've lived with that. And how did I get through it? I was supported through it. So I feel like those are some of the challenges that we have today. There are many more. People are probably running this through their mind going, well, what about this? Yes, if that's a challenge to you, it's a challenge.
I really can't think of a more impactful way to end our time together. So thank you for that call to action. And really, thank you so much for spending time with me today, for sharing your incredible journey, your insights, your wisdom, for showing us those resources. Is just really so impactful to be able to see how this started and then, what it has become and the impact really that you've had. Being inducted into the Ann Hall of Fame, it really is a testament to your dedication, your passion, and that impact of the stable program. And it's been an absolute honor for me to hear your story firsthand. I know others will find it just as powerful, and really just look forward to seeing what's the next step and how this influences future generations. That's certainly that call to action that we will persevere and move forward. So congratulations once again on this well-deserved recognition. Thank you for reminding all of us about the power of perseverance, innovation, and really heart that was woven throughout your entire story. So thank you and congratulations.
Well, thank you for this opportunity, and I'm very grateful for the award.
Okay.